Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. If you spend 3 or 4 or 5 hours a day on your smartphone, or maybe a full 8 hours on a computer for work, or both, you likely are fatiguing your neck and body, creating a condition called tech neck. We'll talk about this with Ryan Martin, a doctor of physical therapy at Upstate. Welcome back to The Informed Patient, Dr. Martin.
Hey, Amber, thanks for having me back on. I think we got a great topic today and one that's applicable to just about everyone out there who might be listening.
I imagine a lot of people are affected, and it seems like tech neck is becoming a more common issue for people in business, schools, industry. Are you seeing people with problems that are tied to the use of electronic devices?
Yeah, we certainly see a lot of patients in the clinic for neck issues, and I think that the use of computers and smartphones are a big contributor to many of these problems. As you said previously, a lot of people spend, the better part of their 8-hour workday in front of a computer, and then after work, they might easily spend a few more hours at home on their phone, computer, TV. So the combined time spent in these positions can come with a lot of cumulative stress on your spine.
Do people come in thinking that it's because of their electronic devices that they have this soreness in their back, or are they surprised when you tell them or ask them how often they're on their phone?
Yeah, I think most people have a general idea that they probably should practice better posture, but I think most patients are probably kind of surprised maybe at how important of a role that plays.
So, what are the key symptoms of tech neck?
Typical complaints might consist of neck pain, stiffness, headaches, pain in the upper back or shoulder blade areas, or potentially even pain, numbness, or tingling in your arms or your hands.
Is this caused by the way we cradle the phone, or just the volume of time that we are bent over texting? Or like what causes those symptoms?
I would say, kind of to put it simply, the essential cause of tech neck is that prolonged positioning, which is typically with your head and neck bent into a downward position or a forward shifted position. The typical posture when we're using our phone or a tablet, we're usually holding that device below eye level and looking down at the device. So that places the head and the neck into that downward bent position. And that's often sustained for prolonged periods of time, again, which just results in that cumulative stress on the spine and the surrounding muscles. Similarly, when, sitting at a computer, we often end up in a little bit of a different position, what we would call more of a forward head posture, with our shoulders kind of rounding over and our head shifting forwards towards the screen. So this also places increased levels of stress and strain on the spine and the muscles surrounding the spine. The common analogy used to kind of put this into perspective is to think about holding a gallon of milk, which weighs about 8 pounds and about the average weight of an adult's head. So holding that gallon of milk at your side is a lot easier than if you were to try to hold it straight out in front of you, right? So in the same way, if you're sitting upright in good posture with your head in the correct position, most of the weight of your head is well supported over the spine, requiring less effort from your muscles to hold your head up. On the contrary, when you're shifted forward or bent down, there's a lot more strain, a lot more stress on not just the muscles, but also increased pressure on those discs in your cervical spine.
Now, can tech neck problems become something more serious than just painful?
Absolutely. So, the strain placed on the neck with these awkward positions can definitely progress beyond that of a simple neck ache or muscle strain. Again, with it putting increased pressure on those intervertebral discs in your neck, that can result in disc bulges or herniations in the neck or the upper back. I think a lot of people have probably heard of those terms of a slip disc or a bulge disc. In those situations, those disc bulges can compress upon the nerves that are exiting from your spine. And that's when you can get into a situation where you're getting symptoms of pain or numbness or tingling or even weakness in one or both of your arms. Often those symptoms can still be managed and treated with physical therapy, but in some more serious cases that could potentially require surgery to decompress those nerve roots. So it can definitely become more of a problem above and beyond just a neck ache or a muscle strain.
This is Upstate's The Informed Patient Podcast. I'm your host, Amber Smith. I'm talking with Doctor of Physical Therapy Ryan Martin from Upstate about tech neck. People would find their way to you probably through their physician, right? Most likely.
Typically, yes. You can go to a physical therapist, what we call direct access, without a prescription from your doctor. But typically people will go to their primary care or an orthopedic and get a prescription for therapy oftentimes before we see them.
This pain would probably have to reach a level for someone to think about bringing it up to their doctor.
Yeah, I would say if it's something that's really persistent, where you're having a really ongoing neck pain, that's just, it might come and go. It may get better at times, but then come back. If it's something that's really persisting and not going away, that would be, a good time to go get a little bit more specific guidance and help on how to break out of that cycle and prevent those recurrences of those symptoms. Certainly, if you're getting symptoms that are starting to travel into your arm or arms, that would definitely be a time to seek out some additional medical attention, because again, that's indicating that there is pressure on those nerve roots that are exiting your neck and traveling down your arm. And if that's not addressed in a timely fashion, that can result in more serious symptoms or long-term nerve damage. So yeah, if it's something that's lingering around and not really getting better on its own, above and beyond just maybe a temporary sore, stiff neck, or if you're getting those sort of arm symptoms, those would be a good time to seek out some additional help and care.
So if you're working with a patient and they're not really improving, they're still having issues or symptoms are developing that are getting worse, do you as a physical therapist refer them to a neurologist or orthopedic person or whatever? Are you able to do that for them?
Definitely, yeah. So we're a piece of the medical team, a piece of the equation. And if somebody's not progressing as they should with therapy, that's typically going to result in either, if they're not already set up with an orthopedic or a neurologist and following with them, that might be a recommendation we may make to get them seen. Maybe they need additional imaging as far as x-rays or MRIs. And yeah, you can get some of that additional imaging and additional treatment if needed. I think a lot of people feel right off the bat that they need an MRI or that they want an MRI and that's going to be the answer and the solution for them. And I would say, to be open-minded and maybe start with some physical therapy, as that can often resolve the issue without the need for that advanced imaging. And that advanced imaging of MRIs and things of that nature typically is going to kind of move you towards the track of injections or surgery potentially. So I always try to educate patients. Oftentimes they come in and again, they say, I just really want an MRI to figure out what's wrong, but try to educate them that that's often not necessary. These problems can usually be resolved without that kind of imaging. And again, once you often get to that point, you're kind of sometimes fast tracking things towards those more, advanced or invasive measures of injections, surgeries, things like that. So start with the conservative therapy, conservative treatment, and those other options are always there if you don't get better with that.
I want to talk about ways to prevent this aside from, because I don't see people wanting to give up their phones. So what can we do? What do you recommend to be on the front end of this and try to prevent it in the first place?
Like you said, I don't see anybody giving up use of their phones, and it doesn't seem to be that the trend is declining for people spending less time on phones or computers. So the biggest thing I think is just correcting your posture and being aware of your posture, not just for treatment of these problems, but also for preventing them. So if you're using a phone, if you're looking at your phone, try to hold it up high enough so that you can keep your head and neck in a level, or what we call like a neutral neck position. Try to avoid holding the phone lower down to your lap where you'll then have to bend your neck down to look at it. When using a computer, try to again have the screen at a height where you're not tilting the head down to have to look at it, where it's closer to eye level. And again, avoiding that forward head position, that's going to just put more strain on the spine. You can think about if someone were to look at you from the side, your ears should be relatively it's kind of vertically over your shoulders. If your ears are significantly forward over your shoulders, then you're falling into that forward head posture, which is going to be problematic. When you are sitting, you can also use a lumbar roll, which obviously is more targeted for your lower back, but that's really where our posture begins when we're sitting, is at the base of our spine, at our lumbar spine. So if you get a lumbar roll, a lumbar pillow down in that lower back area, it's going to sit you up into better posture, which is going to translate right up into your upper back and neck. And it's going to set you up for success there and help prevent some of that excess stress on the neck that we don't want. Another time we end up in poor neck posture, and maybe we don't realize it as much, is when we're actually lying down on our back. I think we all sometimes find ourselves at the end of the day, maybe laying down on the couch or in bed, watching a little TV or playing on your phone. And in order to see your phone or the TV, typically we'll prop up a pillow or two under our head. So this is going to place the head in that same downward bent position as we talked about earlier, but we might be less likely to realize that because we're lying down instead of sitting up. So I would say, as an alternative, try to build up some back support where you can be in more of a semi-reclined position and you can still see the TV or play on your phone, but it will allow you to kind of keep that neck in alignment with the rest of your trunk and avoid ending up in that downward bent position that's going to be more detrimental.
So would pillows potentially help if you kind of prop yourself on a slope with pillows behind you?
Yeah, exactly. Building up kind of some support right from the low back, kind of through the upper back to where you can be comfortably in, again, maybe like a semi-reclined position, but keeping that neck in alignment with your trunk in pushing it forward or bending it down, anything like that.
Now, what about the use of eyeglasses? Would that matter? Would that potentially help?
I would say only as much as if somebody's maybe like struggling to see their computer screen to where they're having to really lean in closer to the screen to see text or something like that. That would definitely be working against you again, as far as trying to be in an upright posture and a neutral neck position. So if you find that, you're struggling to read the computer screen and you're really having to lean in close to see it, then that might be something to think about, so you can try to maintain that good upright position and neutral neck posture when you're using the computer.
Now, let me ask you, are there some stretching exercises that people could do prophylactically just to keep kind of their body ready and nimble and able to move in the ways that they need to?
Absolutely. There's some great prophylactic, preventative stretches you can do. Of course, if you're having neck pain or issues, I have to put the disclaimer out there that you would want to maybe get evaluated by a qualified physical therapist and get some specific guidance there. However, in general, two of the more commonly helpful stretches I would recommend to counteract the typical stresses on our neck would be, one would be what we call cervical retractions, and the second would be what we call thoracic extensions. So explaining these via audio on a podcast might be a little difficult. So if you're listening, you could always Google those, for a picture or a video demonstration, but I can give a little bit of an audio description of those. The cervical retraction, we also call it a chin tuck, because you're basically trying to tuck your chin straight backwards. You can think about almost as if you were trying to like make a double chin. Just make sure you're sitting up nice and tall. And as you do that backward tucking motion, you want to avoid tilting your head upward or downward. Your chin should stay level and move directly backwards, almost as if you were closing a drawer is a good analogy. So you can help guide that motion with a few fingers on the chin, pushing back gently. And these are typically done in a set of about 10 to 15 repetitions and can be done several times per day if they're helpful. And then the thoracic extension stretch can be done a lot of different ways. Probably the easiest way of doing it is sitting in a chair with a lower backrest. You adjust yourself in the seat so that when you lean back, that backrest is contacting you in that upper back area around your shoulder blades. And you just place both hands behind your head and you're leaning back over the backrest of the chair, thinking about lifting up those elbows up and back, which again is going to get a nice stretch on that upper back, that thoracic spine, again, kind of counteracting a lot of the daily positions we find ourselves in where we're a little bit more hunched over, looking at our phone, looking at our computer. So that's another stretch you can do. Again, 10 to 15 repetitions is usually sufficient and can be done several times per day. I often find if I'm showing these to patients in the clinic, they might often say that that's something they already naturally do throughout the day, as they find it to be kind of relieving.
Yeah, it seems like it's a good break too if you're stuck working at a computer for a long time.
Exactly.
Well, thank you so much for taking time to tell us about TechNet, Dr. Martin.
Thanks for having me on. Appreciate it.
My guest has been Dr. Ryan Martin, a doctor of physical therapy at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.